and members of the committee.
Oh, thank you. There's a colleague who loves premiers. Over the moon to see you. Honorable Premier.
Yes.
We have a colleague who loves premiers a lot here in the name of Adeve. You'll be very happy to see you here tonight.
Oh, great.
Chair, contrary to the popular view, Chair. Contrary to the, I'm in the dark seat, as you can see.
The premier is here.
Yes, unfortunately, I'm in the dark seat. Acacia Park, we're on stage 4 load shedding.
Oh, pity, I pity you.
I joined just to ensure that premiers are present.
Hey, Peggy.
Let's start the meeting, colleagues.
Yeah, no, thanks. But don't worry, Chair. I'm going to go next door and borrow the light.
Is that the minister's screen?
One year, now we can.
Is that the minister's screen? I think we need to start. I had initially received the minister's apology, but I see she has logged in here as well. Is here?
Yes, I'm here, but I'll only be here until 8, unfortunately.
Until 8, ne? Welcome,
yes.
Minister. It's good to have you here as well.
Okay, thank you.
Yes, Minister.
Okay.
Mrs. Milane, how are you?
Good afternoon, Chair. I'm fine. How are you?
I'm good too.
Thank you for having us. Good afternoon, Mamkosaza.
Okay, I think let's start our meeting.
Nomagugu, Shomuga, Nosigalala, Ngiyanibingelela, and all the honorable members.
MEC, Minister.
Hayi ngikhona ngikhumbule ekhaya nje kuphela.
Ngiyakhumbula bo.
Hayi sengizofika ke kodwa.
Hayi buya manje.
Ngivele ngasola minister. Ngivele ngasola ukuthi lethiwa la khumbule ekhaya.
Hayi ngithi ngihlale ngibakhona ngithi ungikhonzele ekhaya wena.
Zokulanda.
Please leave my minister alone, Kalip.
She's homesick, shame.
Yeah, I can see that. It's good that they're here. Colleagues, I think we need to start our meeting so that we can have ample time to deliberate with the province, minister, premier, and all the MEC present. I see you've brought a sizable number of your MECs. We want to welcome you, and you in particular, Premier, for making time to be here. We want to thank you for the report on your COVID-19 response, which all of us here had an opportunity to peruse as you submitted it in advance. The data presented. Non-Shatla K, can you mute your microphone, please? Let me just quickly deal with the house rules. Ne? We all know the rules of the virtual meetings, I suppose. You only put your microphone when you are asked by the chair to speak. Otherwise, let's make sure that we keep them on mute because they cause a lot of disruption. The other thing that I have is the request from Parliament TV. They are saying that this proceeding is being recorded. So whoever is given an opportunity to speak, they must switch their video on. We know at times you might have difficulties in terms of your video and connectivity. We'll assess that. Normally they will try to get your pictures from whatever they have in their archives, but they are requesting that you also then keep your cameras on. Honorable Mpumza, can you mute your microphone, please? We are hearing all your conversations from the background. Can we plead with you to do that? I'll
I'm
plead
doing
with
it.
all members to do it. It's still on. You are derailing our progress. Can you mute your microphone because there are people that are with you there? Thank you so much. I was still saying, Premier, we want to thank you for the report that you have submitted to us on time, and want to also thank you for making it your priority to come and be the leader of this delegation tonight. We had since perused your report that by virtue that you submitted it on time, that gave us an opportunity to go through the report. And as we were browsing your report, we noticed that the data presented in your report suggests that the curve of new infection is going down. The peak of about 2,000 daily cases reported towards the end of July, we have noticed that it has since dropped below 300 new cases by the end of August. We have also noticed in your reports the incidence risk, which measures the number of active cases per 100,000 of the population, has been showing signs of abating. Only 4 of the province's 11 districts have an incident risk of more than 100 cases per 100,000 of the population. Premier, we want to welcome this promising trend, and we appreciate the hard work the province has put in to bring down the infection curve. However, we believe as a committee that there's still much work to do to minimize the risk of a new wave of infections. The province still faces the formidable task of ensuring that the people remain vigilant, use personal protective equipment optimally, keep social distancing, and maintain hygiene and health protocols without fail. Just today, Premier, we saw the enormity of this challenge in the province when a group of 35 artists and entertainers blocked the roadway and staged a mini concert on the N3 near the Pavilion Shopping Center. There is also a need to increase efforts to implement transparency and accountability measures to ensure that the looting of COVID-19 funds through irregular procurement processes are monitored. In a media release earlier today, appreciating also the work that you have been doing in responding to this issue of PPE procurement, the Auditor-General has also noted that the relief package government has redirected as a response to COVID-19 pandemic landed in a very weak control environment. This weak control environment has affected all provinces, and KwaZulu-Natal is also no exception. We have seen all the media reports relating to investigations, Honorable Premier, into alleged corruption in the KwaZulu-Natal Departments of Social Development and Education, which also found irregular government expenditure amounting to 29 million. The investigation indicates that officials took advantage of the declaration of the national state of disaster in the purchase of PPEs and blankets in the wake of COVID-19. We also appreciate your update on the progress on this matter, that the SIU is still looking into this matter. We also note, as we peruse your reports, that the province has attempted to minimize this vulnerability by publishing the details of COVID-19 related expenditure in the province, which amounts to 2.9 billion. This is a welcome step towards increased transparency, premier, and accountability, which have important deterrents to fraud and corruption. However, we have noted some things in this May alluding to you, Premier, admitting that 100 million mistake in the COVID procurement disclosure report. That is a matter we believe that it's going to be corrected with time. When we want to then, as we engage with you tonight, Premier, that yourselves as the provincial government, you must also have to deal with this matter of the procurement disclosure report. Then we also want to understand, in you taking us into confidence, that it is serious, you are serious about consequence management in respect of those officials implicated in unlawful self-enrichment in the wake of COVID-19 pandemic. With these few words, Premier, I want to welcome you, and then as the leader of the delegation, I should think you present an overview of the reports, which I said that the members have already browsed and perused. Then I should think you just highlight the matters that you feel the committee need to take cognizance of, and then you'll decide whether any of your members of the executive will have to put some additions. I want to hand over to you, Premier, and the delegation, and welcome you to this virtual parliamentary portfolio committee meeting. Over to you, Premier.
Thanks, Honorable Chairperson of the Portfolio Committee, Honorable Mtambi. Greetings to members of the Portfolio Committee. Special greetings to the Minister of Cooperative Governance and Traditional Affairs, Minister Dr. Nkosazana Dlamini-Zuma, members of our Provincial Executive Council, compatriots, ladies and gentlemen, we welcome the opportunity to engage with the Portfolio Committee on matters relating to COVID-19 and our response as the province. We have been honored by the invitation and we respect that. However, we must set the record straight that we are accounting to the portfolio committees in the province, and all departments have been engaging with the portfolio committees and with the legislature as a whole. I'm saying so because it is important that we understand the line of accountabilities and the fact that we have been observing that and following. Our report will cover the program of the KwaZulu-Natal Provincial Command Council, the work done by COGTA, the work done at a human settlement level, the work we've done in the education department as well as health, and the work done at a level of infrastructure under the leadership of Public Works. With regard to the Command Council, the COVID-19 infectious disease, which has to date reached the pandemic proportion, was first diagnosed. The first case was here on the 5th of March this year. It was then declared as a pandemic by World Health Organization, and that also triggered response by the province as well as the national government under the Minister of COGTA, as well as the President. As I said, the first was that the cases were imported cases, with those infected were coming from Italy. And since then, cases started increasing rapidly. And as KwaZulu-Natal, we started making a plan, especially the response plan to contain, manage and mitigate the pandemic. A multi-stakeholder or a multi-sectoral coordination was established to ensure that there is a proper response. We have established the Provincial Command Council, composed of all MECs, the chairperson of SALGA, the chairperson of the House of Traditional Leaders in the province, as well as the representative of the legislature. But equally, we cascaded that to district, where we established the same structures. The Command Council in the province is tasked with the following. Firstly, ensuring that healthcare response is geared up in a comprehensive manner to ensure that we respond and mitigate the risk imposed by the pandemic, capacitate emergency medical services, establish and maintain screening capacity, continuous educational and public effort to ensure that we conscientize the people, ensure an integrated approach in the fight against COVID-19, and that included the socio-economic response, the work from justice and policing, and the response from various government structures. Command Council adopted a continuous, consistent, and effective communication approach. In our report, we have presented the structures coming from the National Coronavirus Command Council, the provincial, then the district. We have also presented the technical teams at an administrative level. In terms of activities, we present there. We meet every week, and the technical team also meet every week, is chaired by the Director-General. The disaster management team meets also twice a week and is led by COGTA, and there is Prof. Joint. MECs are assigned to districts to support the district command council in line with our work of the Sukuma Sake, which was integrated to the district development model, DDM. We are providing the schedule of meetings of our district councils. Then when it comes to the report of the situational cases or the situational report, as at the 31st of August, the country has 627,041 confirmed cases, and we specify the new cases, the death, the food recovery, and allocated. We then come to KwaZulu-Natal, that by yesterday we recorded 279 new cases. KwaZulu-Natal continue to be the second highest in number of laboratory cases after Gauteng. The province has recorded 13 new COVID-19 related deaths, and then the province also contributes 15% of the countrywide fatalities. We present there the curve in terms of the reporting to date, that in August we had about 805 cases daily, and of the 279 new cases recorded on the 30th, and it tells you that the graph or the curve is going down. We then present the cases per district, and that is the new cases, the total number of cases, as well as the fatalities we have suffered in the province. In total, we have 279 new cases. The total number of cases is 113,006. And in terms of deaths, we have 2,152. And in terms of percentage of the fatalities, we're at 1.9 in terms of the percentage. And then with that, the incident risk by district is presented there. The overall incident risk for the province is around 93 cases per 100,000 population. Then we present per district, which covers all districts. We then present a summary of laboratory confirmed cases and the summary of laboratory confirmed cases, which is between the 5th of March to the 31st of August, which is 113,006. Then there is distribution of patients by age and sex. We are reflecting there that female cases continues to dominate with approximately 60% in terms of confirmed cases. The number of cases decreased with increase in age in both male and female. Majority of cases are between the age of 30 to 39. Now there is an overall presentation there. In terms of admission and isolation, on the 31st, the province had 1,049 patients, 69% in private hospitals, and 31% in public hospitals. And we indicate there that of those admitted, 236 patients were in ICU, and among that, 50% needed to be ventilated. We reflect on admission in public facilities in terms of total number of patients, those oxygenated, ICU, as well as high care, and the total number of admitted, treated, and those who were oxygenated, 140, ICU 30, ventilated 17, and it goes on. We then give an account per the healthcare facilities. safe to say that 33% of those who were hospitalized were in Inkosi Albert Lutuli and followed by Edendale. COVID-19 field hospital, which are working as quarantine and isolation site, we then report there on what we are having per district in terms of the facilities that are there and in terms of the location. Allow me not to bore you with details, with the hope that you can go through that on your own. In terms of the expenditure, by this 27th of July, KwaZulu-Natal had spent an amount of about 2.9 billion on the COVID-19 related expenditure, with 1.9 coming from the provincial departments, about 925 million coming from municipalities, with public entities accounting for close to just above 4 million. Now we provide that 57% of this expenditure was dedicated on infrastructure. And these are projects that relate to upgrade and alteration of healthcare facilities, and therefore they will be used even post-COVID-19. Our report in terms of the expenditure have been made public and is accessible. We are now moving to also present the directors of companies in terms of actual names and everything. We provide the expenditure per department, and as expected, the 3 departments that has the highest expenditure, it's health at about 1.4, and then education at 487 million, and then followed by social development at about 54 million. We then give the breakdown per also entities, with trade and investment being the highest, 1.2, and KwaZulu-Natal Liquor Authority at 920,000, Gambling Board at about 622. Then it goes like that. The top 10 contractors contributors to COVID-19 expenditure in terms of the municipalities. We have listed them there: eThekwini, Umkhanyakude, Umhlathuze. It goes down like that. I would say eThekwini is about 447 million. Now that exhausts the work we've done in relation to the expenditure, and then at the level of COGTA, we have worked on structures, the alignment of structures. We've been also working in terms of ensuring that we guide in terms of providing circulars to municipalities, and in terms of ensuring effective communication and constant engagement through our IGR structures. And in this regard, our structures are linked by the fact that MECs also sit in the district command council, but also there is a Munimec where the MEC for COGTA meet with mayors, and that is complemented by the provincial, by the premiers coordinating forum. There is constant communication, including communication and business continuity. We have been engaging over and above the communication channels. We're also utilizing platforms of the social media such as WhatsApp, especially where the mayors are communicating and the municipal managers. COGTA has also developed the post-lockdown recovery plan for municipalities, and all municipalities are implementing that. Water supply have been done by COGTA, which include static tank, distribution and installation, and in some cases, borehole programs. And the education department is now working on borehole programs. MIC reprioritization, assisting municipalities on approvals, which were sought to obtain and amend the MIC business plans as well as a reprioritization plan. The provincial master plan in KwaZulu-Natal, we develop a provincial master plan, we're developing it and it's being finalized. But in terms of interventions that are expected, that is what is expected there as we are presenting. Traditional affairs, the department procured and distributed approximately 840 sanitizers to all, and with those PPEs distributed. And it conducted also the cleaning, waste picking, clearing of illegal dumps, and public campaign on sanitization of public areas. Local government economic recovery plan is also in place, entailing elements of focus that we ensure that there is a resuscitation of economy, and our main focus is on clothing and textile, informal economy, health and innovation, fourth industrial revolution, tourism, trade and investment, infrastructure development, agriculture and agro-processing, supporting creative industry, and ensure that we deal with red tape in a proper way. We then give the details of the work that have been done in response and in support of informal settlement, as well as business management, where the department established a business continuity management committee for COVID-19 to assist in advising accounting officers, but also in trying to ensure that we mitigate the effect of COVID-19. Traditional leaders have played a crucial role in the fight against COVID-19 during the period of alert level 5 up until now, with Amakosi participating in the campaign to curb the spread of COVID-19 and encouraging people to follow the regulations, including ensuring that cultural activities, funerals and sport tournaments are avoided and not hosted. And where funerals were held, then people would be encouraged to ensure that they follow and preserve the protocols. We then present the infrastructure in terms of the effect of the budget cut on programs, including the service delivery, and some are those of the project that will be affected. With regard to human settlement, The plan was on COVID-19 response was about responding to overcrowding, high-risk areas with limited access to water. The program was launched at Inyoni, where we dealt with the issue of disinfections. The department then rolled out the community-wide sanitization program and the community mobilization and education campaign. The department also focused on water and sanitation programs, which were implemented in various areas throughout the province. More areas of intervention going forward are around identifying public land and land preparations for people. Then Department of Education, after the closure of schools as part of flattening the curve, then grade 12 and 5 returned on the 8th of June. However, due to the increase in infection, the National Coronavirus Command Council further closed on the 27th. On the 3rd of August, grade 12 returned, and they were followed on the 11th by grade 7, and then the rest of other grades as elaborated there. The PPEs were provided in each schools, and that included face masks, face shields, hand sanitizers, disinfectants, thermometers, liquid soaps, gloves, and all others. There was an orientation also that was held where all teachers were orientated and then the learners were supported. The department have signed the service level agreement with municipalities on provision of water, and they rent water to supply water in other areas. Department provided 3,480 static tanks, and they continue to provide support as elaborated there. And the issue of social distancing has been a challenge, but it was handled well and effected in a number of schools. And the department is now considering desk shields. Partnership, the Department of Education, they work with the Department of Health in terms of health guidelines, screening guidelines, and all that. They partnered with local and regional radio stations. They also partnered with Public Works. The Bidvest also cleaned some schools, COGTA municipalities, and ran water on the issue of water. The use of Vodacom school is being finalized for all grades. There are budget constraints. Right now, the department is facing 1.1 billion shortfall. Service delivery limitations. That is as a result of large number of teachers applying for concessions due to comorbidities, as well as enough, even though municipalities have partnered, but there are challenges with regard to supply of water in some of our schools. A total of 470 schools were vandalized during the lockdown, and that also imposed challenges. Insufficient learner transport is one of the challenges, and there is a disruption in schools that continues because of public protest, and most of these are community protests that have nothing to do with the education. We present a slide where the department implemented social distancing. We then moved to health. The first response was on institutional arrangement, working in terms of being the secretariat and the core team that support the provincial command council, work as part of social cluster and participate in the provincial joint operations committee, the JOC, but also establish the Department of Health provincial war room, and then also ensure that municipalities are assisted. Activation of the outbreak response team, which were done effectively, and engaging on health promotion and prevention strategy. And that strategy was rolled out in KwaZulu-Natal throughout in collaboration with UKZN. The focus was on unpacking what needed to be done in terms of behavioral change. And there was a lot of community engagement which happened through communication, promoting the behavioral change, but promoting also that people should follow the guidelines as expected. Preventative and awareness campaigns were held, including mainstreaming of public awareness and training of all community-based structures, ensuring appropriate communication to public travelers, and a dedicated focus on healthcare workers, provision of PPEs, extra material needed and equipment for purposes of social distancing, addition of staff complement, and implementing quarantine measures and self-isolation measures. Risk communication. The risk communication aims at creating the awareness about this disease. Department has identified a core team of senior managers who supports the MEC and the HOD in this work. They've engaged with traditional leaders, KZN Council of Churches, the department's interfaith organization, Women in Business, Port, Airport, Border Control. And this is one department that have been all over. 24-hour call center was put in place, and the number is there. The case management, and I think the department has been very effective in terms of the case management. Critical care plans have been put in place per hospitals, standard operating procedures and all. Healthcare facility preparedness was one of the focus in terms of ensuring that we repurpose some of our wards and hospitals, but also in terms of ensuring that even temporal field hospitals were reconstructed. Resource enhancement, the provincial disaster conditional grant allocation for 6 months to fund the response of the department. There was also a reprioritization toward filling of vacancies. Occupational health and safety measures, various measures were put in place to promote a safety environment and get into details there. Profile of quarantine facilities, that's a detail of our quarantine facilities with beds, availability or capacity as of the 25th August. And then the lockdown measures assisted in preparation of The first wave, quick turnaround for SCM, setting up of field hospitals, sourcing nationally the expert information and relation of what came from World Health Organization, establishing support from the academia and social partners, and then continuous support of the work of the Provincial COVID Council. Risk, second wave is one of the risks, and that is the mitigation approach suggested, health or community awareness, and continue with increasing contact tracing. And then we deal with the issue of facilities accommodation, as well as the risk of infected healthcare workers. And then we indicate there what needs to be done, that the province is seeing a remarkable decrease in number of COVID-19 cases since the beginning of August. This is an indication that the province reached its peak and the trend is going down. We must be alert and put preventative measures to strengthen our response and avoid the second wave. Now, in relation to, I think we have reported with all we needed to cover, but I must then indicate that in terms of social development, our task or our program focused on interventions to ensure that, firstly, we provide mitigating support through the social relief, which was done fair and very good. And then we also intervene on the plight of homeless people, and we managed to deal with their plight. But we are also continuously engaging. The department continue to support people who are in various homes with continuous support. So that is our report. We have not dealt with it in detail, and we hope that the members of the committee will interact with the report. We've dealt with issues of corruption as reported, and all of those issues are now with the SIU and being investigated. All of them, from the Department of Education and the Department of Social Development. We believe we must give the great appreciation and thank the healthcare workers for their dedication and for being there in the front line of the fight against this pandemic. Any success that our country would score, accolades will need to go straight to our healthcare workers. Thank you, Chair.
Thank you so much, Honorable Premier. Yes, we appreciate the presentation. Members, can I see a show of hands who wants to interact with the presentation as Honorable Hussein? Who else? Kalipi? Who else? Unevals? Who else?
Honorable Hadebe.
Hadebe. Who else? Kaiser. Who else? Direko. in that order. Can I start with you, Honorable Lucen?
Yeah, Chair, thank you very much. And
apologies, Honorable Hussein. Is there another member who's raising a hand whom I missed? That could be Honorable Mpumza, as always. Okay, sorry, Honorable Hussein, you can proceed now.
no, that's fine. May I just extend our appreciation to the Premier for his availability and the presentation. It's good to see him before the Portfolio Committee. I was hoping that our good Premier would have been here a long time ago, given that this was the lead committee of COVID-19 and the disaster management in the country. But we do appreciate that he's made himself available to at least give the Portfolio Committee an update on some of the progress that they are making. May I also just start with a positive comment, in the sense that I'm sure that since the lockdown has been announced, Chairperson, that there has been quite a bit of work done in the province in a number of areas, for which I think that we must extend our gratitude to all of the officials in the various departments that have contributed to try and mitigate the spread of the virus to whatever extent. Comment first, a positive comment. What is rather unfortunate, I think I'm just going to turn this camera off, Chair, if you don't mind, because I think the signal is a bit bad. Chair, may I just confirm if you are hearing me properly?
Yes, I can hear you. Proceed.
I think that the signal was going down, so I'll just drop the camera if you don't mind.
Okay.
Yeah, Chair. The unfortunate thing is that KZN has been in the public and in the media for all the wrong reasons recently, notwithstanding some of the good work that has been done that has already been covered by the Premier in his presentation. And I'm encouraged by his closing comments around the issue around corruption, that a number of the cases are being investigated, and those cases are significant. They're not minor that can be dismissed without us as a portfolio committee getting a full and proper detailed briefing. For example, the 22 million rand scandal, blanket scandal, that were the money that was spent. We've talked about it previously on the portfolio committee, and I know that the Premier says that there's been some investigation that is underway. But I would really like to hear from the Premier whether or not people are being held accountable for it. Have they been suspended from the positions that they hold? How many people have actually been suspended? And he has not revealed the name of those companies, and I will appreciate if he can also let us have the names of those companies that are now being fingered. The Premier, in a public statement, Chairperson, has undertaken to get to the bottom of all of these corrupt activities. The Department of Education, Department of Social Development, and a number of municipalities across the province. So I would like him to spend a little bit more time on that. He's just made it in passing as a closing comment about what's being done, but I'm afraid that that's not enough. And if we have to, as a portfolio committee, have to do our job properly and conduct effective oversight over the KZN province, then I think the Premier has a responsibility and a duty to provide us with much more information than just simply saying the matter is being investigated. We would like to have the full details. Bearing in mind also, Chair, that the Premier publicly has committed to ensuring that lifestyle audits will be undertaken in the province. This was earlier in August, if I'm not mistaken. So it's gone quite a while now, and if the Premier could please give us an update on that promise that he's made to the public in respect of lifestyle audits. It was on the 13th of August, to be precise. And have they undertaken that process already? Have they started it? And by when can we expect at least some sort of report to be made public on the lifestyle audits and what exactly has he found? Then, Chairperson, I want to also ask the Premier about the catering scandal that has dogged his own department, on what progress is being made there and whether or not officials are being held accountable there. Have any of them been suspended? Where exactly is that matter at the moment? The third issue I want to raise with the Premier, Chairperson, which has been something I think the Premier was not very comfortable with dealing with in the public domain recently, and that relates to the 67-year-old gentleman who passed away at the Northdale Hospital. And in an interview on TV, and I understand that he was trying to provide an explanation during that occasion. If he can please give us an update on it. It's been quite a few weeks that have passed now. I know that officials have been suspended. What action is being taken regarding that specific incident where a patient was treated in a car park in one of the hospitals in KZN? And how far is that investigation, and when will it be concluded? I then want to just raise with the Minister the expenditure from municipalities, and I find it fascinating, Chairperson, that I can understand that eThekwini will have the highest COVID-19 expenditure in the province, given the size and the density of the population. But by comparison, the second highest expenditure is a rural municipality of Umkanyakude. And to me, that does not appear as if everything is all right in terms of that expenditure by the size and the density of the municipalities. And if the Premier can perhaps maybe take us into his confidence and just tell us whether or not the expenditure in Umkanyakude municipality, whether he's satisfied with it or whether to him it appears suspicious. And are there any other municipalities in KZN that he believes a closer look needs to be taken in respect of COVID-19 expenditure and the manner in which municipalities have been spending money during, especially when it comes to PPEs? Chair, the last point that I want to raise with the Premier, which is the very controversial point, and when it comes to fraud and corruption, it's unfortunate that KZN has received a lot of negative publicity recently in respect of fraud and corruption. And the provincial government, I'm afraid, is not providing any sense of comfort to the people in the province to make the residents of this province believe that they are serious about fighting fraud and corruption. And in particular, I'm referring to, Chairperson, the recent appointment of the former mayor of eThekwini, Zandile Gumede, who herself has been picked for fraud and corruption to the amount of 430 million rand. And I'd really want to invite the Premier to make a statement on that matter and explain just how is it that he sees it fit that somebody who is already in court at the moment for fraud